Okay, we're going to talk about a case that we saw just yesterday. It's pretty interesting. So the scenario is a young wrestler who came in, and he had previously had low back pain for which he presented to an outside orthopedic group. He ended up having an MRI, and he was found to have L5-S1 spondylolisthesis, which is just where in the lower part of the spine there's a little bit of movement of the spine. It's actually a fairly common cause of low back pain in young athletes. But when he came in, so that was kind of the story coming in. I said, okay, his spondylolisthesis is acting up. But when he came in and we started the exam, his pain was actually higher up in the back. It was on the left side and it was higher. And he hadn't been feeling well either. And the pain was just very bizarre in terms of when I was feeling around, it just didn't feel like it was muscular. And I said, wait a minute. And we had him turn around on his back on the table. And I started feeling his belly, and he was tender there too. And I said, uh-oh. So we grabbed the ultrasound machine. If you want to zoom in, let me find the images here. Okay, so what I did is I was curious, I was interested in looking at his spleen. So that's where your organ, your spleen is. And I did a comparison ultrasound of my spleen. So I put the probe on my own belly, and you can see this is my spleen. And this is the size of it. So the spleen is right here, and at the same level on the belly in this patient, this is his spleen. So you can see it's like 4 times or so the size of mine. Again, there's his, there's mine. So he has mono, and in mononucleosis, a viral condition, your spleen can get big. And the biggest fear there is that it would rupture. Because if it ruptures, that's not good. You'll start bleeding internally, and it's just not a good scenario. So that's why when you have mono, clinicians will tell you just rest, relax, don't engage in any vigorous activity. So we had to shut him down from wrestling, unfortunately, because if he were to take a hit there, number one, he's infectious, so he could spread the infection to other people. But if he were to take a hit there in the spleen, that would be no bueno. So we had to shut him down. He wasn't too happy about it, but I'm glad we were able to find the right answer for him.